Live from 6 News Studios. With live, local, breaking news where you live. And your hour-by-hour forecast. This is Channel 6 First News. Live at 4.
Good afternoon. And that leads us into our regular element here live at 4. Go to WWT.com right now. So how do you think court is going to rule on all of this? Can Congress have that ability to force you to buy health insurance? Just join the conversation. Look for the blue and green 6 Online Live banner. We will share some of your thoughts a little later on in the broadcast. Well, you might not have noticed it, but this Thursday, 1 week before Thanksgiving, is Prematurity Awareness Day. And one local hospital the system is trying to do more for preemies and their families, and you can help here. Joining us to talk more about it is Tanya Patry with the Methodist Women's Hospital. Thanks so much for coming in.
Thanks, Brian. How are you today?
Very, very well, thank you. So as a father of a premature child, I mean, what kind of happens here, and I think this is where you're going, is you don't reach where you were supposed to, and so you probably haven't had baby showers yet. You haven't even thought about doing some of those things, not to mention now you have to buy clothes for a child that's a lot smaller.
That's true. Most of our parents weren't aware that they were going to have a premature birth, with the exception of those that might be having multiples, which we do have quite a few of. But we end up with babies in our NICU that are there for several days, several weeks, even several months. And what we're trying to do is collect clothing and other items to make the babies and their families feel more at home in that environment.
Because there are a lot of worries that people have when they're your child. You don't even really, in some cases, get to hold your child. They go straight into an incubator or something like that just to be cared for. It's kind of something to help relieve some of the stress that they maybe have.
Yes, that's true. There are a lot of things that you do need to worry about when you have a premature child. So anything that we can do to help our families feel more at home is important.
What are some of the items that you're asking the public to drop off?
Onesies, sleepers, booties, blankets, and socks and little hats and mittens to dress the children.
Go for the smallest sizes, I take it?
Preemie sizes and newborn sizes are the ones that are in most need.
Do they actually have the preemie size? Because I don't ever remember seeing
they
that.
They do. You'll find the little premature P, and then the newborn sizes are also good, 0 to 3 months.
And they're making so many strides medically, I know, too. A lot more premature children are surviving. So the pool is even bigger. That you need to tap into.
We did reach records in our NICU last month of 35 babies, which of course we're trying to avoid as many premature births as possible, and there's lots of things that can be done to do that. But there are also many cases where we can't predict that a child is going to be born prematurely. So we do support the March of Dimes and their mission to avoid prematurity as much as possible, but when we can't, then we want to give our patients and our families as much as we can to support them.
Well, here again some of the details on how you can help. Methodist Women's Hospital asking for donations to its neonatal intensive care units of gently used preemie size onesies, bottoms, infant sleepers, booties, socks, mittens. There's a whole array of items. Donations can be made at the Methodist Women's Hospital. That's at 192nd and West Dodge, Methodist Hospital 83rd and Dodge, and Jennie Edmundson in Council Bluffs. If you missed any of this, we have it repeated on our web channel. Go to WWT.com and click the Quick Click button. Thanks for coming in.
Thanks, Brian.
Still to come here live at 4.